We've got a great panel tonight, so let's get straight into it. Former Resources Minister and Nationals MP for Hinkler, based on Bundaberg, Keith Pitt. He's here in Brisbane today, and Chief of Staff to One Nation, James Ashby, joining us from Yeppoon. Bit of weather up in Yeppoon. James, how are you going there, mate?
Well, it hasn't stopped since we spoke last week, Gary, so it's been good, and I think the farmers appreciate it because it's certainly been steady in these neck of the woods. A bit heavier up north, though.
I love that comment from Greg Williamson, the Mayor of Mackay, who said, "It's summer, it rains. Just stop getting hysterical." Yeah. Apparently Taxpo Radio is getting hysterical today. Anyway, Keith, great to see you. Also, pressure's ramping up on the Queensland Health Minister, Yvette D'Ath, to finally resign over, well, the Queensland maternity crisis. Mothers too fearful of giving birth at Gladstone Hospital, for instance. They're travelling great distances to better hospitals. This is just a mess. I mean, James, let's face it, it's between where you are and where Keith is. D'Ath should have resigned months ago, James.
She sure should have, but the problem is who takes her place. Labor here in Queensland have a very incapable, incompetent amount of members elected to the Queensland state government here. And unfortunately, they also have quotas of women in their ministry. So without Yvette D'Ath there, who are they going to replace her with? The short answer is they don't have anyone. The problem that we have, wherever you go regional, Keith's in the same situation as us. Hervey Bay now has maternity, Maryborough doesn't. Gladstone is a population, it's a footprint slightly larger, so it takes in Tannum Sands and outer areas of about 50,000 people. Yep. And here, families cannot go and give birth in a natural sense at the Gladstone Hospital. It's impossible, and instead they've got to travel north, and it's 100 kilometres. Now, there's a lot of roadworks, and it's quite a dangerous stretch of road. If in an emergency you've got to get your wife or partner to the Rockhampton Hospital, it's critical in its own right, and ambulance have got better things to do than transport pregnant women hundreds of kilometres to give birth.
Yeah, all because the hospitals don't work. I mean, let's face it, Keith, Anastasia Palaszczuk, she'll throw her under the bus. She'll throw her under the bus if she feels there's a political problem. She might just be using that bus pretty soon.
Well, I mean, on the list of which Queensland Labor minister should resign, it's a 10-way go and a dead heat, in my view. I mean, Mick de Brenny should have gone ages ago with what happened with the Queensland Building and Construction Commission. But now you see, you know, on average, more than 900 women with antenatal services around Gladstone with no services whatsoever. I mean, children don't arrive to Anastasia Palaszczuk's timetable. They just don't. And what really concerns me is this is a tactic that Labor is using to drive people out of the regions. Yeah. They're taking away maternity services throughout regional Queensland. They're winding down and degrading our hospital systems, and there's a lot of hardworking people. They're trying to do their best. They are being let down by Queensland Labor.